Hello everyone. It's so nice to have this lesson with you all. This section will talk about the diagnosis and management of lung abscess. A brief introduction of myself. I'm Wei Wang, a physician of respiratory and critical care medicine, the first hospital of China Medical University. For lung abscess, we talked about the clinical manifestations. So how to diagnose it? Usually, when we diagnose lung abscess, we should differentiate from other disease with similar manifestations, such as bacterial pneumonia, tuberculosis with cavity, lung cancer, bronchial cyst with infection, or others. Let's discuss in detail. Pneumonia. Here we could see the X-ray of pneumonia. These patients usually have fever, cough, sputum, similar as lung abscess. But from the X-ray, there's difference. Here, we couldn't see the cavity and air fluid plane in lung abscess. We only see the infiltration. This is pneumonia. Second is tuberculosis. For these patients, tuberculosis is also an infectious disease, but the patients showed slow onset, fatigue, afternoon fever, night sweat. In the X-ray, we also can see some cavity, but these cavities, the wall is thick, no air fluid plane. This is different from that of lung abscess. And for tuberculosis, the site usually be apical posterior segment of upper lobe or apical segment of lower lobe. Acid fast stain is positive. If we could see this result, we can diagnose this is tuberculosis. Lung cancer. Lung cancer is not an infectious disease, so the patients always showed slow onset, irritable cough, blood-stained sputum without fever. An X-ray could also see some space-occupying lesions in the lung, or eccentric cavity with thick wall. So this cavity you could see here, very typical, very thick wall, unsmooth inner wall too, no air fluid plane. This is the difference between lung cancer and lung abscess. For lung cancer patients, X-ray also can show some enlarged ileum and obstructive pneumonia. Pulmonary cyst with infection. This is also can be confused with lung abscess, but for this disease, pulmonary cyst is usually congenital and easy to be infected. The symptoms can be shown as infectious related, for example, cough, sputum, fever. X-ray, we could see this cyst, but this cavity is with thin and smooth wall. This is different from lung abscess, and usually the patients have this from very young age. After diagnosis, we should give some management. The management of lung abscess including 4 parts. The first is supporting treatment. If the patient was diagnosed as lung abscess, they should have a good rest, get enough protein, calories, and vitamins. Also prevent dehydration, give enough water. If the patients feel that they are short of breath, oxygen therapy should be given to them. The second part, and also the important part for lung abscess management, is antibiotics. For these patients, if the bacteria is the pathogen, they could be prescribed by penicillin or cephalosporins. If it is infected by anaerobe, metronidazole can be given to these patients. A very special condition that if the patient was infected by methicillin-resistant Staphylococcus aureus, MRSA, only vancomycin, teicoplanin, or linezolid could be given to these patients. So how long will we use these antibiotics? Because it's an infection with cavity, so usually 8 to 12 weeks for therapy. Antibiotics treatment shouldn't be stopped until no symptom, no chest pain, chest radiograph shows total absorption of abscess, or only left some stable fiber change. The third part is pulmonary physiotherapy. Usually, we should put all of these parts from the lung. So mucolytic agents is usually prescribed for these patients, such as ambroxol. Aerosolization is also could be used. With this, normoxylin or acetylcysteine could be used for aerosolization, and back percussion is also be used by the nurses. Postural drainage is also very important. From this figure, we could see that with different part of disease, we could choose different position for postural drainage. And also, bronchoscopy could be used to directly for drainage of the sputum. The last part of the management is surgical care. Usually, lung abscess could be cured by internal medicine care, but sometimes, if the patients are failure to respond to medical management for more than 3 months, or suspected neoplasm, or with complications such as emphysema, bronchopleural fistula, or with severe hemoptysis, when these conditions are happened, surgical care should be used first. So this is the whole content of lung abscess. I hope that with this lesson, we could be familiar with disease and could diagnose and give proper management for lung abscess. Thank you.